Tonight, we are here with Paul Demeda, and we're talking about orthomolecular principles and concepts for a better nutrition practice. So this was of interest to a lot of you. And I put out another email about it last night as well, which got a really good response. So I think everyone's really excited for this topic tonight. So Paul's going to be discussing how to use orthomolecular principles and knowledge within your practice and some of his personal experience as well, how it's improved his confidence, and then how you as nutritionists can also use this in your practice as well. So we'll be diving into some concepts, some supplementation practices, and Paul, you said you'll be illustrating that with content that's been presented by all sorts of different orthomolecular practitioners, MDs, NDs, and lots of others at the Orthomolecular Medicine Today conferences too. So those are like my favorite things from the year. So I'm excited for that. And so I guess what is going to be included in a nutshell, why orthomolecular practice is ideal for nutritionists, some key concepts and principles of orthomolecular practice, what it is, what that means, and then talking a little bit about orthomolecular nutrient dosing, the efficacy, safety, and evidence. And for those of you who are already here, we do have some prizes for those of you who attend live. So make sure you stick right to the end. We have a 1-year membership for the International Society of Orthomolecular Medicine, and then also a hard copy book of Light on Schizophrenia by Abram Hoffer, which was re-edited by Paul as well. So make sure you stick to the end for those. So I've alluded to you a few times, Paul, but haven't formally introduced you yet. Thank you for being here. And for those of you who are on the call and don't know Paul, he was one of my professors at IHN way back when, and he's been on staff there for almost 20 years, is it?
Yeah, I think it's 20 now.
Yeah, it's got to be pushing that. So Paul is really dedicated to investigating, clarifying, and explaining important nutrition issues and concepts, and is a proponent of critical thinking in the context of health and published research as well. So he has lots of experience, obviously, with teaching, and currently teaches nutrition and mental health and clinical detoxification in the continuing ed department at IHN. You also have a role as program facilitator, is that right, at the International Society for Orthomolecular Medicine?
I do.
And I mentioned has edited that Light on Schizophrenia book, which is an amazing accomplishment. So welcome, Paul. Thank you for being here again. I'm really excited to see what you have to talk about tonight.
Well, thank you, Veronica. I'm happy to be here today because I love sharing good information, good concepts, and I've had the privilege to be exposed to a lot of good material over the years. Stuff that kind of blew my mind, but also stuff that is quite practical working with clients. So you covered a lot of the stuff I was going to talk about at the beginning there, but here we go. I got into orthomolecular because way back when I got invited to attend the Orthomolecular Medicine Today conference in Montreal, 2009. And I went there and blew my mind. For starters, I was seeing presentations by some of the people who are in the field doing, they were talking about what they're doing, but they're also talking about their research, but also got to see people who were behind the content we were teaching at IHN, which was pretty interesting and pretty cool. I was blown away because there was I'll say a science in the true word or true sense of the word behind the things that were being presented. And it was logical, usable, and it was way above anything I had been exposed to for mainstream for before that. After that, I was so excited, I decided that I would see if I could take the highlights of these 3 days and condense them down to 3.5 hours. And so first I asked the school if they were okay with you doing that. And they said yes. And then went to the Orthomolecular Medicine Society and they said yes. And then 100 hours later, after compiling and organizing, I presented the first one of those highlight presentations. The amazing thing, though, was what I learned in those 100 hours, because it's one thing to sit and watch, and it's another thing to work with the information. So that really got me hooked on the orthomolecular conference. And so I went to the next 10, I think, or so, did highlights for all of them, and that was quite good. 2014, I actually presented at the conference. I was only the second non-doctor to ever present in its like 43-year history. And I presented on, it was a controversy, should we be doing high dose fish oils? And what is it, like 8 years later, it still stands up. So it's good. I do believe in high dose fish oils, just at the right time in the right place. And the second time was in 2018, and I spoke about whether you could get all the nutrients you need from food alone. And I'm going to be doing a little segment from that later on today, or later on this talk. And yeah, at ISOM, so I do lots of projects. The Light on Schizophrenia was a year-long project, pulling together Dr. Hoffer's book and then updating with everything that we know now. And so basically supporting his book. And really happy about the mental health pages. There's another year of my life. We'll talk more about those at the end. And then lastly, the COVID-19 page, which was almost a year as well. But the responses from those pages people are quite pleased with them. It's quite incredible, the response we've been getting. So that is kind of what I do. With ISOM, we are moving the organization from more tightly focused on doctors and naturopaths to the public realm. And this is one of the first ventures into doing that. The nutrition is kind of the middle ground. And so it was quite interesting putting this talk together and organizing and structuring so to help get it into the public realm. So I'm going to start based on that, and just give it a second. Wait for it to come up. There we go. And okay, so orthomolecular principles and concepts for better nutrition practice. And yeah, so we got to start at the beginning. What is orthomolecular medicine? And so ortho means correct or the right, and molecular means molecule. And so it's essentially about finding the right molecule in the right dose at the right time for the right person. So it's very person specific and context specific. There's many definitions over the year, been tightening them up. And so orthomolecular therapy, the practice using nutrients like vitamins, minerals, trace elements, amino acids, fatty acids, micronutrients, and other naturally occurring substances to promote health and healing. So that's it in a nutshell. It's kind of a little big there, but there it is. We have to talk about medicine. And so medicine is the science or practice of the diagnosis, treatment, and prevention of disease. It's not strictly mainstream medicine. They have stolen that term. I remember doing a sweat lodge with some Native American or natives, American, what do we call them? Aboriginals. And they referred to medicine as the peace pipe and the tobacco and the strawberries and the cedar that they used in the ceremonies. And so medicine is the correct term. Sadly, it has a bad connotation now because of what's been done to it. So we are looking at talking about, I'll often say, orthomolecular practice as well. And so there's our baseline. So orthomolecular is a layer of thinking that augments whatever professionals are doing. So for your nutritionist, you do your nutrition, but it augments how you think and what you may do. If you're a medical doctor, same thing. You still do your medical practice, but this is in addition to, so it augments it. Orthomolecular has been around for quite a while. It unofficially started way back when, 1973 or a little earlier, with Dr. Klenner, who was doing high doses of vitamin C, 50 to 60 grams per day for things like polio. They were able to cure, he was able to cure for sure polio with high dose IVC in 3 or 4 days, which got suppressed, of course. So Dr. Klenner, if you read about him and his uses of vitamin C, it's quite astounding. Dr. Kaufman used 3 to 4 grams of nicotinamide, so vitamin B3, for arthritis. And Dr. Hoffer and Osman then used nicotinic acid, so niacin, up in the 3-gram range and higher to treat schizophrenic patients. Linus Pauling coined the term orthomolecular psychiatry. He did it in one of the journals there, Orthomolecular Psychiatry, which was published in Science, which was one of the biggest journals at the time. And basically, orthomolecular psychiatry is basically said, if you optimize the nutrient status in the mind, then you can basically help the person mentally, schizophrenia in this case. And so Linus Pauling then wrote a book on vitamin C and the common cold, which was completely valid, but scared mainstream medicine. And they started the attack on not only Dr. Pauling, but orthomolecular in general. Roger Williams in 1971 basically proposed the concept of biochemical individuality. So every person is unique depending on their genetics, lifestyle, environmental exposures, and other things. Dr. Pfeiffer talked about having too much of things, environmental toxins and things like that. And so that gets us to where we are now. Orthomolecular molecules, so the definition of them, or which ones we consider to be orthomolecular. You got the vitamins, minerals, amino acids, fatty acids, and cholesterol, enzymes, hormones, neurotransmitters, and then other naturally occurring substances that take part in metabolic reactions in the body. So it's things that are needed by the body or found in the body that promote health and proper metabolic function. Also relevant is the macronutrients, the protein, carbs, and fats, although they're not actually orthomolecular molecules. So what about herbs, mushrooms, and other botanicals? We don't consider them to be orthomolecular. We kind of consider them to be orthomolecular adjacent. So orthomolecular medicine doctors will use them. They will talk about them, they'll present about them, but largely in the context of how these substances modify orthomolecular molecules. So a good example would be ashwagandha. So how does ashwagandha work? Well, it's a herb. It's got certain phytonutrients in there, and they alter genes transcription and writing of genes, which then have functions down the road, downstream, that are dependent on those molecules. And I'll talk more about that coming up. So orthomolecular encompasses nutrition, so that's us, biochemistry, which is also us, cell biology, also us, pharmacology. The true definition of pharmacology is mechanism of action of naturally occurring mediators and drugs, so things that work in the body and how they work. Also physiology was a little bit us, and then toxicology, which is definitely us as well. So as nutritionists, we have pretty much a full spectrum of all things in the orthomolecular domain. So now to talk about the principles of practice, and make sure my throat stays nice and lubricated there. So so principle number 1, orthomolecules considered first in diagnosis and treatment. So these are things we look at first. Knowledge of safe and effective use of orthomolecules is essential for a reasonable standard of care in medical practice. So what that kind of says is, if you are a professional and you're not talking about nutrients, then that is below the standard of care that we would expect from our medical professionals. So you need to know what they are, and you need to know how to use them safely and effectively. And that's what orthomolecular, what we do is we train people how to do that, or we help people do that properly. Principle number 2, low risk of toxicity for orthomolecular molecules or orthomolecules. And I've noted this over the years, massively high doses within reason and very, very safe. I'm going to quote Dr. Kaufman here. I noted that niacinamide alone or combined with other vitamins in 1,000 patient years of use has had no adverse side effects. Other examples, this is actually on my website. I have an article called um, Do Vitamins Kill People? And so this is a chunk of that. So not even one death was caused by dietary supplements in 2008. 2009, 2010 were quite similar. I think 2011, two people died. One person choked on the capsule, which I've almost done that. And I forget what the other one did, but it was completely unrelated to the actual substance, so or the actual supplement. So no deaths. And so we have our clients do, and our patients, depending what you do, have this for the most part come in and it's like supplements are dangerous. My doctor told me they're dangerous or inherently dangerous, but on the other hand, they have the belief that medications are inherently safe. And if we look at the reality, this is a chart I love showing. Basically, as you go from left to right, you get more and more dangerous, more and more negative health effects. And as you go higher up and the bigger the circles are, the more people are affected. And so here's adverse drug reactions. So this is properly taken, properly prescribed medications. And over here are the food supplements, so the nutrients and the herbal remedies. There's a little asterisk beside both of those dots. You can't see it on the screen, but the asterisk, if you scroll down to the end of the study, it says the dots had to be enlarged because if they were drawn actual size, they wouldn't show up in print. So very safe, not all that safe, and yet people believe in this, and we have a hard time convincing about this. So we'll talk about addressing that coming up. Orthomolecular principle number 3, every person is biochemically unique and should be treated according to their particular biochemical factors and metabolic factors. One thing I've found, I've worked with over 1,000 people now, and there is a baseline of things that pretty much everybody needs, nutrient deficiencies that are quite common. So everybody needs like a handful of things like vitamin C for sure, some sort of essential fatty acid, magnesium, I could go on, but there is a core. But then above that, well, with that core, even you have to pick your dosing, match the person. But then above that, picking targeted nutrients, it's not just look it up in the book. What does it say here under cardiovascular disease? Oh, this, and this, I'm going to throw it in. It's really about the context of the person and using maybe that recipe for cardiovascular disease and going, what is relevant on that recipe list that would work with this patient or client? So this is Dr. Williams basically talking about biochemical individuality. I'm not going to read all that, but I'm going to show you some examples here. So how do we know everybody is biochemically unique? Even identical twins, as they age, if you look at their genetic expression, it changes over time, and it changes the longer these twins are alive. So if bioidentical or identical twins are not bioidentical, then everybody else is even more less bioidentical. I wrote an article. This one's called You're Different. It's also my website. And it actually started, I was at Whole Foods and I saw two books side by side, one about vegan diet being perfect, and the other one was about paleo diet being perfect. Both implied it were for everybody. And I go, well, this is crazy. Both of them think they're right. How do I know they're wrong? Because people are different. So I sat down and spent a couple hours making a list of all the ways people are different. And I use this with clients all the time. So it's broken down into three parts. What people got here with. So when they were born, what did they have? What was affecting them when they were born? What's happened to them since they were born? all the things they run into, and all the things they are doing, and then what are they doing right now that makes their needs different from the next person next to them. So you can check that out. As you can see, there's quite a few factors that make people different. Number 4 for principles, nutrient-related disorders are treatable and deficiencies are curable. So if the condition is caused by a deficient of nutrients, putting the nutrient back in can fix it. We will say almost always. You can always get the nutrients back to normal. Whether the condition has gone on too long and whether it can be fully restored is a different matter, but usually it can. So pellagra is probably the most commonly known nutrient deficiency. It's vitamin B3 deficiency. And one of the things it causes is changes in perception when the vitamin B3 gets too low. And so this was from one of the papers Dr. Hoffer wrote. This is Dr. Hoffer writing this girl's name out, and then he asked her to write it. And this is what she did. And she wrote it out like that. And so clearly deficient in vitamin B3, 30 days on nicotinic acid, so niacin, the perceptual changes cleared up completely, and she was fine. Acute cases of pellagra, so 0.5 to 1 gram of niacin per day quickly turns it around. And if it's chronic, so been going for a couple of years, still responds, but very slowly. So we know that nutrients can turn things around. Nutrient amounts required for therapeutic benefits may be much higher than the dietary reference intakes or reference daily intakes. Remember, those two references are for people who are healthy. They're intended for healthy people, not for healthy people who are sick. So orthomolecular says that's not for helping people get better. It's for helping people stay where they are. Although I did see a study where they were using zinc, and it was in the context of anorexia. And so they used 30 milligrams of zinc and for the treatment group, and the control group got the RDA, which was something around 5 milligrams. And at the end of the study, the treatment group actually improved, and the control group actually had less zinc. They declined in their zinc levels with the RDAs. And so what do we know about going above the RDAs? So for healthy Canadian adults, we look for a level at least 100 nanomoles per liter, which would be considered normal or healthy in Canada. This study used 82 Canadian adults, and their 25 OHD was where it should be. They gave them 4,000 IU or 400 IU of vitamin D for 18 weeks. And what did they find? With the 4,000 IU, but not the 400 IU, they got improved visual memory, executive functions, and they got the better results of people who are actually deficient at the time. And so remember, the RDA for vitamin D is 600 IU. Effective dosing is around 4,000 IU in this indication. Vitamin B12 is linked to brain shrinkage. And so study done on men people over 61 years old. And they found that they needed 500 micrograms, so 50 times the RDA to have benefit in the context of memory loss. Moving on, so principle number 6, lab tests don't necessarily represent nutrient levels in tissues. They represent, so blood tests and other tests. So blood test for sure gives you a serum level, but not a tissue level. And so one of the places that is quite relevant for this is in mental health. And so here we go, a study of cerebral spinal fluid, 26 of 45 patients with normal serum levels. They were deficient in the cerebral spinal fluid. And so 8 out of 10 in the postpartum depression group. So 8 out of 10 were pathologically low, so close to zero. And so if you're just going by the blood, which you should never do if you have mental health issues going on long-term and chronic, then you're going to be out of out of range because that it's not reflecting the tissues. Actually, I'm going to tell you one more story. Dr. Riordan, doctor down in the States, he was one of the few places, or his clinic was one of the few places that was allowed to do IV vitamin C to treat cancer legally. And so in Wichita, Kansas, and he was out riding his horse and he got off and he got bit by a rattlesnake. And so yes, what happened is that he was starting to get really sick. They took him to the hospital and they said, before you start that treatment, take my vitamin C level in the blood. And they did, and it was zero. And so the serum was zero. And the vitamin C still had it, went somewhere else. We'll talk about that coming up. So blood tests, not always the best indicator for us. Number 7, it's always essential to address the root causes. Is something we've learned way from the beginning. It's always drilled into us. And so I'm not going to go in depth into this. We're going to give you one example, though. This was Dr. Jeff Katulski, a osteopath down in the States, and had this 87-year-old woman was brought to him. She had fractured her humerus 2 weeks prior and immediately went into atrial fibrillation, was addressed in the hospital, but then she became psychotic and irritated, and nothing they could do could address it, and they couldn't figure out why. So they brought the woman to Dr. Katulski, and he did a full assessment. And what did he find? Her father was a painter, used lead paint all the time. She had lead paint stored in her long bones because she was exposed to it all the time. When she broke that bone, the lead was released into the blood, went into her brain, and caused the psychosis. And so they chelated her, and basically she got back to normal without looking for that root cause. That woman never would have gotten better. Principle number 8, orthomolecular treatments that are known to be safe and possibly effective, they warrant a therapeutic trial. And so basically, we don't know if it's going to work. We suspect it would work. We know that it's safe. Let's try it out. More on that coming up. And so one of my favorite quotes in this context is Dr. Prowski, Jonathan Prowski. And so, although I could test for this compound, the compound is Mo factor, and that's one of the things you test for in schizophrenia and a few other mental health conditions. It identifies pyroluria. So although I could test for this compound, I choose not to, since these nutrients are inexpensive and have minimal side effects. The daily dosages I routinely start with are 250 milligrams of pyridoxine and 50 milligrams of zinc. So with pyroluria, you deplete pyridoxine, so vitamin B6, and zinc. So he knows the context. He knows that neither of those at those doses are a risk that can only be beneficial. So he goes to his patient, let's test it out. And so what happens, you run it for a month. If the patient gets better, then you got a pretty good clue that that's going on. If they don't, then you look somewhere else. So if it's safe and possibly effective, you can do a therapeutic trial. So therapeutic trials are N of 1 studies. And so basically they go like this. And this is what I do when I work with clients. So what do I want to learn? So what am I measuring? What's this? If we do this trial, what's it going to tell us? Is the trial appropriate for what I want to know? Is it safe? And if you have an orthomolecular history, if you look into the research, you know about the safety of it. So yes or no. And then are you going to titrate? So you're going to take the dose up gradually, or are you going to go for some other type of dosing to provoke an effect? And then how long will it be before you see results, and what results do you expect to see? And one key thing is always change only one parameter at a time if you're doing therapeutic trials, right? Even if you are working with somebody and you're not doing a trial and you're adding more nutrients in, um, always do it in a way that, let's say you added fish oils, do it in a way that you know that whatever happened, good or bad or in between, it was the fish oils that did it and not something else. Okay, number 9 there, biochemical needs of a patient change over time and with treatment, and recommendations need to change accordingly. So you don't just put somebody on a nutrient, like say vitamin C at 20 grams or 10 grams and leave them there for the rest of the time. So you need to follow up with the client, see how they're doing, and then go, okay, based on the symptoms you have now, we're going to lower this and we're going to add this or that kind of stuff. And so things that typically change when you're working with people, digestive enzymes, we typically bring those down if you're using them. Vitamin A, the context I use them in for digestive healing is, I'm going to put quotes here, quite high. And you wouldn't leave the person at that dosing for a long period of time. Vitamin C, I tend to saturate people, then bring them down. Vitamin D, depending on whether they have a blood test in front of them or not, or what you suspect, you might go quite high for a period of time, but then you have to check and then bring it down. And then magnesium is another one. Magnesium is self-regulating, so is vitamin C actually. So less concerns about that, but you do definitely have to look at, is this dose appropriate, and do we need to change it? Medications, I'm going to talk about those too. Typically, when we work with somebody who's taking meds, and this approach is, why are they taking the meds? What are the meds trying to address? And okay, so now we're going to do that. But with nutrients, as you provide the nutrients and they start doing the job and allowing the body to do the job that it was supposed to do, that the medications are doing, their need for the medication is going to go down, and you have to warn them about that. And so you kind of have to give them what to expect, and then when to ask their doctor about lowering their meds. Just remember, we're not allowed to change prescriptions. We're not allowed to tell people to lower their medications. Number 10 for principle there, likelihood and implications of toxin exposures. So it is quite likely you have to assess toxicity in patients. That is just one of the foundation principles. You know, I teach, I think I made a note here, I teach the continuing ed course, clinical detox. We do 3 sessions on toxins alone, how to identify them, what they are, how to identify them, assessments. So that's about 9 hours just on toxins. And, you know, I've learned over the years, you know, I got into health because I had chemical sensitivities and almost died, and then came out of that. And then I became an expert in toxicology while I was sick. I became an expert on detox after I was sick, after I got better. And one thing I have learned when it comes to toxins, it's not a question of if you have toxicity, it's just a question of how much and how far along is it in influencing your health. So for me, toxins and detoxification are a no-brainer. Okay. Yeah, I can't tell you how many times I've done intake assessments on clients, and my intakes are about 700 questions long, mostly symptoms, but yes, gone through the intake and they have some sort of system or constellation of symptoms, and I have no idea what is going on. There's no clear indication. And then we start talking about toxic load. They go, oh yeah, I renovated the house, or I worked on a farm. I had one client who was perfectly fine until she went to Thailand, and she walked out in a field to get a nice picture, and a plane that was spraying pesticide flew right over, and she got completely soaked, clothes and everything in pesticide, and not the less poisonous stuff that you get here, like the DDT stuff that they use in third world countries. And so if you don't ask about this kind of stuff, you're going to miss a smoking gun every once in a while. So look for the toxins. Number 11, when drugs are, this is not really for us, but when drugs are necessary, the lowest dose that provides therapeutic benefit should be used and gradually reduced as the recovery the patient permits. So it is kind of for us, because if somebody's taking a med and we're helping that patient recover or client recover, then their dose needs to be taken down incrementally. And, you can say you need to go to your doctor. They'll probably say no, or you can make decisions yourself, and then things become a little more complicated. You have to inform them on risks and reasons why they might want to get off the medication or the side effects of the meds, but then the risks of going and reducing their dose. A lot of people come to me and they already say, one of the 3 reasons I'm here is to get off my meds. I'm not prepared to work with a doctor because he or she is not willing to do that, but I'm going to do it one way or another. And so what kind of advice do you offer, and how do you do that safely? That's one of the things you'll learn the more and more time you spend with orthomolecular and, working with people who do that kind of stuff. And okay, this one's a fun one. To deny the patient access to orthomolecular information and treatment is to deny the patient informed consent for any other treatment. So think about that one. If you don't tell people about nutrients, that is denying informed consent. So if you go, we're going to do heart surgery on you 6 months from now because XYZ, and you don't mention nutrients, that is denying informed consent. So there are basic elements of informed consent, and one of them is you must advise the patient of alternative procedures or treatments, and nutrition is one of those. The biggest one I can think of is, how do you treat COVID, right? And the medical system suppressed everything they could about nutrients and their efficacy in addressing COVID. And so they basically said, here's your med, or go home and wait till it gets better, or we're putting you on a respirator and all that kind of stuff, without talking about, or get your vaccine, without talking about the role of nutrients in the immune system and addressing inflammation and energy production and stopping the cytokine storm, all that kind of stuff. You're not talking about that. That's denying that person informed consent for the treatments that they are presenting. Okay, number 13, hope is therapeutic and a natural outcome of exposure to orthomolecular information therapies. So one of the things Dr. Hoffer, who's like one of the founding fathers of orthomolecular, always talked about was hope is therapeutic. And, mainstream medicine does not provide hope. They provide Band-Aids, but, for somebody to truly get better, hope is one of the main elements. And so I'll tell you how I inspire hope with people. They come to me and nothing's working, and I go, okay, well, vitamin C is known to do this, this, this in your context. Have you taken it? No. Okay, well, maybe things are going to get better if you try that. Magnesium does this, this, this in the body. And, this protocol has been shown to do this, this, and this. So you're not specifically saying for them, but you are saying these are the things that they can do. You haven't been doing them. Here's an avenue you have not explored. This should be uplifting for you. And a lot of times people have told me, you're the first person who's given me hope. You're the first person who's talked about this. Right. And then the last one of these principles is the patient right of freedom of choice in medicine. Medicine treatment must be respected. And that's really the crux of everything. You got to respect your decision in the end. Nothing should be forced. In our context, it comes up, we work with people with cancer, and you explain everything about cancer, and they choose to go with chemo just because they're scared. They've been talked to in a certain way. And so what do? Do you yell at them? No. Do you tell them they're making a big mistake? You never do that. But you respect their right to do that. And then you help them in any which way you can. You can support them for that. But also remember, you're not obligated to work with anybody. So if they make a choice that's destructive, then you don't have to work with them. Okay, so those were the principles. Why is orthomolecular ideal for nutritionists? Its foundation is nutrition. That's really it. It's inherently holistic because even though we're just talking about molecules and using molecules, the use of those influences on a bigger scale, and you have to kind of think holistic to actually use the molecules properly as well, because you have to consider the whole person, the whole body. And using nutrients is inherently safe. So how does orthomolecular make nutrition practice better? Well, it uses diet and supplement. So, I'm going to show you supplements are quite important. It uses both of those. It's an effective starting point. So if you have a person who has mental health issues and a whole bunch of other stuff going on, family issues and all that, you can go, I'm going to start with the nutrients, and I'm going to start with the physical body. Because remember, we as humans are a soul inside a physical body, or, this physical body is the vehicle for the soul to get its learning and do its expression. It's the physical body is why we're here. And so if you start at the orthomolecular molecules or orthomolecules, the parts that make up and determine the functioning of that body, that's a good place to start. So you start with nutrients, and then you see what's left after that. Doesn't mean you don't work on anything else, but you kind of go, here's my core, here's my starting point. And orthomolecular works, no doubt about it. I've seen it's about, it's 50 years now, Orthomolecular Medicine Today conferences. So it's has a long history of working properly or working well. Using supplements and food is affordable, relatively affordable. Depends on your supplement loads and things like that. If we were in the States, and some of you are in the States, where you have to pay for your own medicine, then it's definitely affordable by comparison. And you can do orthomolecular without having to do medical testing. You can get access to some medical testing, but you don't have to have it to do orthomolecular medicine. All right, here's a few of the concepts that have shaped my practice here. The concept of deficiency, nutrient deficiency versus nutrient dependency. And so deficiency is when you don't get enough of the nutrient from your food, and then the normal body functions start to degrade and dysregulate. Dependency is where, based on your genetics and a few other factors, you need more to be normal or function normal metabolism than somebody else. And so dependency is different from deficiency, and typically you have to address it differently. And so this is from Dr. K. Hall, dependencies. So respond only to large pharmacologic doses. So basically, because of the genetics, the person needs more. And so in schizophrenia is a classic example where is schizophrenic. So some subset of them require high amounts of niacin to overcome the genetics that basically cause that person to write less niacin receptors, especially in the brain. So less niacin receptors, less impact of niacin for that person, less benefits of niacin. So if you jack up the amount of niacin that the person gets, so you address that dependency, there are more niacin hitting those receptors, And then you basically get normal metabolic function out of it. So classic example of using a nutrient to overcome a dependency. So we can get dependencies from environmental toxins, say change our genetics, anything that changes genetics. Trauma is another big one that does it. And then the context in the womb. So is the mother insulin resistant in the womb? Are they eating too much sugar and starch? Are they not getting enough protein? That's going to cause changes of the genetics in the womb of that person and can result in dependencies. There's others, but that's a short list. This was orthomolecular detox premise number 5 from a presentation by Dr. Ron Huntinghockey talking about detoxification. And basically what he's saying is nutrients at orthomolecular doses can overcome genetic variations that interfere with detoxification. Classic one here would be the MTHFR polymorphism that affects the way we deal with folate, and that affects how well we produce and use glutathione. Another concept, number 2, is triage. So basically, this is one of my favorite ones. The triage theory, this is basically says, and this is from Dr. Bruce Ames, that when we have shortages of nutrients, we kind of we make decisions about where the nutrients are going. And so the first thing to go, this is a nice description here, visual. The first things to go when you're nutrient deficient are things that have minimal consequences on health and disease. And then as the depletion gets worse and worse, you start to get insidious things, start to get in the context where diseases might be coming. And then finally, we lose the essential functions that are required for survival. So that's the triage theory. We can turn that around and kind of go like this. When somebody gets those nutrients back in, the first thing that's going to be addressed is those essential functions. And then it's going to be the things that prevent disease. And then it's going to be the superficial things. So I think of that in the context of something like this. This is a human disease network mapped out. A lot of things aren't labeled here, but basically it shows that there's a lot of interconnection of things that are going on with diseases. And so if we look at this and say somebody has a myocardial infarction, or say they've had a heart attack, and they've come to you and they go, this is what I got, I want you to fix it. And you go, okay, so what we're going to do is going to be pretty good. We'll do a base thing, but we're going to do these, say, 2 or 3 nutrients, and that's the way we're going to do it. But let's say they have that and they also have asthma. And so now we got asthma's over here somewhere, and kind of tied in closely or not so closely. Now we've got another list of things that are good for asthma. And what if we add, say, hemolytic anemia? And so now we have even a bigger complex. We got a whole bunch of things going on. And so what I like to say is the more a person has that's going on, the easier it is to get started, because the answer is thinking nutritional triage. I'm going to put the base nutrients in, and they are going to start working throughout the body, throughout all those systems, putting it where it needs to go first. And then as time goes by, it's going to start working on more and more and more things, and we're going to see more and more benefit throughout the body. So that was one of the ones that definitely helps with my practice there. Mega dosing is another context there. And so we have the RDAs, which are quite low. We have regular orthomolecular dosing, which is much higher, but then we have the mega dosing. And a few things have kind of shaped the way I do that or think about that. Dr. Klenner, so basically he said small amounts of ascorbate don't work. If you want results, you have to use adequate, which is quite high doses. And so this is how you prove that vitamin C doesn't work. And this is how they proved it at the beginning there. They used small doses and said, no, doesn't work at all. You have to use sufficient dosing. Cathcart used up to 100 grams oral in divided doses in people. because they were in such a state, high inflammation things, they could take it. If you check out our ISOM website, the COVID page, we have protocols there for COVID, but any virus. So it might be useful for things that are going to be thrown at us coming up. And so for vitamin C, every hour a gram. And I've had many, actually probably about 7 people with full-blown COVID send me emails. I send them to our page to look at that protocol. They do it and they come out of COVID within 3 or 4 days. And and they can actually do this 1,000, so 1 gram an hour for 18 hours a day, and take it without laxative effect. 3 times a day, vitamin A, 150,000 IUs. That's 150. That's yeah. So 50,000 3 times a day, 150,000 IU. I've been exposed to people with active COVID 5 times. And the first hint of anything, I have done that. And next morning, completely, completely better. Like no signs, no symptoms, nothing. And but look at vitamin A. It's been used up 200,000 IU for 2 days, so that's hefty dosing. So we're definitely talking mega dosing. Measles, 200,000 IU, and then acne, 500,000 IU daily for 12 weeks. Women, slightly lower dose. So, if you're worried about vitamin A, just take a look at these numbers. You can go to the webpage and see the actual references for that too. And this is Dr. Vasquez. I love this quote, and I quote it with clients all the time. Now, what I might do in my own clinical practice is to put someone on vitamin A, 100,000 units to 300,000 units every day for 7 to 10 days. They're not going to get vitamin A toxic in that much time, but that will help load their tissues with vitamin A so that we can induce the response that we want much more quickly. So if you're worried about vitamin A, look at those numbers. One caveat, with existing liver and kidney issues, you probably can't do that. So you have to be careful. So if you want to know about, how do you know what dosing ranges and things like that for mega dosing or even regular orthomolecular dosing, Linus Pauling Institute is a great resource. You can just Google Linus Pauling Institute and a nutrient, it'll get you to their micronutrient information center. The NIH, separate arm from the ones we hear too much about. They have a section called the National Center for Complementary and Integrative Health. And so if you type in this and whatever nutrient you're looking for, you'll get information. What you're looking for is not the recommendations or the RDAs. You're looking for the studies that they cite and the doses that were used in those studies. That's where one of the ways we get our numbers is we just go through that list of like 50 to 100 studies and you go, okay, so this study did, vitamin A at 100,000 IU for 3 months. This one did zinc at, 100 milligrams and on and on. You also could look at our mental health pages and see the dosing that's used there, and dosing that's recommended and ranges there as well. Another principle is titrating up and down. So if you're going to use a therapeutic dose, you always start lower. Active COVID would be a different case. You want to go right into it. But let's say you're doing cardiovascular disease. So you want to start with a lower dose and titrate up. So build that dose up over time. Why do we do that? Because we don't build receptors for nutrients, or we keep them low if the nutrient supply is low. And as the supply increases, we build more and more receptors to increase absorption and utilization. And common nutrients to titrate: vitamin C, niacin, magnesium for sure, fish oils, things like tryptophan, tyrosine, anything to do with mental health issues, probiotics as well. And just know when you're dealing with people with mental health issues, like severe ones, go very cautiously. So you start low and you very slowly take the dosing up. And got to talk about the concept of loading doses. So sometimes we want to quickly get somebody up to a dose or a level And so that we can see the effect, they can see the effect, they know it's working, they can now have faith in the process. And then as their need goes by, you can bring it back down and do lower dose, lower therapeutic dosing. And just an example of how things are titrated. So this is Dr. Aileen Burford Mason. She runs this protocol with everybody that she works with for magnesium. She's a magnesium fanatic. 100 milligrams magnesium before bed, and then over 3 days you increase it in 500 milligram increments, and you alternate that increase between day and night, and you continue until you get 2 to 3 soft bowel movements per day. And because she's such a magnesium proponent, she hates to see magnesium wasted. So don't go to the bowel tolerance. And so then you back off by 500 milligrams, and then that will go down as time. The capacity to handle the magnesium goes down over time. Example for 5-HTP, 50 milligram increments up to 300 to 400 milligrams a day. Remember to cross titration is bringing down the med while you're taking up the nutrients. This one's quite interesting because we were taught to never ever do 5-HTP with SSRIs. And this is Dr. Prowski, who's an expert in getting people off their meds, including SSRIs. If you slowly taper the SSRI down, and slowly titrate the 5-HTP up, unlikely you'll ever get serotonin syndrome, which is too much serotonin. So it's doable. You really need to know your stuff. I have had clients who are taking both their SSRI and I think it was like 100 milligrams of 5-HTP, which I found shocking. But there you go. Few little tidbits here. I'm going to kind of quickly go through these. High prevalence of hypovitaminosis C and D. So I would call it an epidemic of vitamin C and D deficiency. Classic signs of scurvy, pathological dysfunction, fatigue, and lassitude. Any of that out there? It's like more and more every day. So here's a study that Dr. Abram Hoffer's son did, and I did in a hospital setting in Montreal, teaching hospital there, and they were studying vitamin C and D on mood and distress in the hospital. It's a randomized double-blind clinical trial, and it was actually in active units, and they avoided people who were critically ill or on their way to intensive care. So it was kind of sick people. And what they found was 70% of people who had subnormal vitamin C, 30% of them were below the cutoff for scurvy. So there is a component of our population walking around that has scurvy. And for vitamin D, more than 80% were insufficient, 5% were deficient. We're starting to talk that there's no difference between insufficiency and deficiency. So 85% of the population in the hospitals were deficient in vitamin D. But doesn't stop there. So 10% of general population is deficient. 30% of smokers are, and 60% of acutely hospitalized patients. So these are the people we'll be working with, right? All of these people. So why would people be deficient? Reduced food take, not using vitamin supplementation. This is what they found in the study. Any supplementation, including a multi, seemed to be somewhat protective. Systemic inflammation is a strong indicator, and high CRP, which is a measure of inflammation. And then here's one that kind of blew my mind: expanded cellular fluid space. So this is why Dr. Riordan, his blood level was 0 for vitamin C after the snake bite. This is what happens. So we have something called the extracellular fluid, which makes up what's in the blood, and the interstitial spaces, the spaces between cells. Normally, the vitamin C is in the blood, in the cells in the blood, and not very much in the interstitial fluid. When you have some sort of trauma, hit by a truck, a spider bite, snake bite, other things, then what happens is inflammation goes up, the interstitial fluid space expands, vitamin C goes into it, and the amount of vitamin C in the blood drops. So here it's 40 grams per liter, and now it's gone to 20. So this person's now going to be massively deficient in vitamin C. More bad news, 47% of young non-smoking adults in Toronto have insufficient or deficient vitamin C. So you could pretty much say half of your people are going to be vitamin C deficient. It's a no-brainer. And a few other things I like to throw in, I get asked about this all the time, vitamin C and head trauma. So vitamin C decreases the size of lesions or size of tearing or damage inside the brain after head trauma. There is a nice little diagram. There's the lesions example. The more vitamin C, the smaller the size of lesions. Vitamin C decreases intracranial pressure. So whenever somebody bangs their head, gets a I'm having one now. It's not a stroke. When you bang your head.
A hematoma?
No.
A concussion?
Concussion. Thank you. When they have a concussion, vitamin C as soon as possible, right? And vitamin C relieves cellular hypoxia, so low oxygen status, restores aerobic metabolism, mitochondria, improves apoptosis. So vitamin C is an absolute no-brainer. All toxins cause free radical damage. If they don't cause free radical damage directly or indirectly, they're not toxins. All toxins can be completely neutralized by vitamin C if you can get a high enough amount into that tissue. And so high amounts of ascorbate are a non-rate limited antioxidant that just floods the body and scavenges free radicals. Something to keep in mind, vitamin C is it gets into the cells two ways. One is through the sodium ascorbate receptor, and one is through the GLUT receptors. So if you don't have enough sodium, low sodium diets decrease the amount of vitamin C getting into the cells. And this GLUT receptor also does glucose. So high amounts of glucose, carbohydrates, sugars, you now have, they compete with vitamin C for absorption. And if somebody has insulin resistance, which affects these guys, then the uptake of vitamin C is affected there as well. Theory of dynamic flow basically goes like this. The more vitamin C you need, the more you absorb and the less you lose, less you excrete. So basically that means, even though they say, anything over 2 grams of vitamin C a day is all wasted, that's not true if you're sick. Vitamin D deficiency common in most countries. More than 25% of the population in Italy and France are deficient, and majority of those 50-75 years are deficient. And leave it at that. Some risk factors for vitamin D deficiency: age, obesity, diabetes, hypertension, smoking, and not getting vitamin D in the diet and not going out in the sun. This was shocking when I heard it. In Europe, it's common to give babies 2,000 IU per day for the first year. What does that tell you about 1,000 IU being the maximum for adults, according to conventional wisdom? So vitamin B3, I'm going to quickly go through these. I'm not sure. Do we have a time limit? I think I got another 10 minutes.
Yeah, no, I don't have a time limit.
Excellent. Okay. So vitamin B3, useful but underutilized. I am shocked at the amount of people who come in who have mental health issues and are not taking vitamin B3 in one form or another. I'm even more shocked when somebody comes in, they're taking massive doses of niacin for schizophrenia, which happens once in a while. So niacin, vitamin B3 form, or niacin or nicotinic acid, they're essentially the same thing. That's the flushing form. Nicotinamide is non-flushing. When it comes to things like treating schizophrenia, this is more effective. This is less effective, but still useful. I'm going to show you a few uses for niacinamide or nicotinamide. Oh, niacinamide is the one I'm talking about. And then this is non-flushing. And then we have an acetylhexaniacinate, and that's non-flushing, but has benefits for schizophrenia. So what does B3 do? Lowers lipids. That's kind of almost an inconsequential thing, even though we can use it as a tool to keep clients off of statins. Has antihistamine properties. It's a methyl acceptor, which means it can accept methyl groups from adrenaline to keep it converting to adrenochrome, which is a factor or potential factor for schizophrenia. More importantly, it's required for NAD production and energy production. So this is from Dr. Hunninghake. We burn calories thanks to activated oxygen. So oxygen as a nutrient activated, and it mostly occurs with iron molecules. I can show you that in a second. And Dr. Hofer said niacin had a lot to do with favorable electron flow. So take your niacin every day. Dr. Hofer took niacin every day, right to the day he died. And he was fully functional, fully cognizant. He was actually in the office with a patient. I think he was like 92 or something when he died. So that niacin kept him going, kept him sharp and focused and high energy right to the end. This is a diagram that took me a long time to figure out from what I was given, but it basically goes like this. Here's vitamin C, here's oxygen, and here's NAD, which is vitamin B3. So here we have the iron. Iron is converted from the 3+ to the 2+ by vitamin C, which donates electron, right? And so then iron then goes on to gain an electron from oxygen, and the oxygen is then made into superoxide, which then is converted by SAW to hydrogen peroxide, which we use, especially white blood cells. But that's converted safely back into these molecules there by converting the iron back into the 3+ mode. NADH, which is, let's say, niacin, loses its hydrogen to go back to convert the iron again. And so there we have NAD. And then what does the NAD do? It is used in the electron transport chain. I don't know if you remember this, but here we go. Here's the mitochondria, and we are making ATP. That is what we want to do. In order to do that, we have to pump these hydrogens into the intermembrane space, and we need to accept the electrons, or we need to accept the hydrogens. And so what do? Is there's the NAD. Actually, we need to donate the hydrogens. The NAD is part of this. And so without the NAD, we can't make ATP. And that's in every cell in the body, but especially so in the brain. Yeah, for me, mental health and detoxification are everything. So I talk about the brain a lot. So NAD required for energy production. And the other things when it comes to mental health, especially schizophrenia, it helps correct subclinical pellagra, vitamin B3 deficiency. By the way, pellagra looks a lot like schizophrenia. This is one of the connections that Dr. Hofer made to actually start using vitamin B3 with people with schizophrenia. B3 increases serotonin production, which is good for mental health. So how does it do it? If we are deficient in B3, then we take tryptophan and we run it through a whole bunch of enzymes and convert it into vitamin B3, right? So, or into NAD actually. And so if we supply it, then we don't steal from our tryptophan supply. Vitamin B3, especially as niacinamide, sedative and benzodiazepine properties, so calming properties, especially in higher doses, and increase effectiveness of some sedative, tranquilizers, and anticonvulsants. So basically, it can help people get their dose of meds down, because the medications, they do work sometimes, not all the time, but sometimes, and but they're toxic. They have toxic side effects. So if you can get that dose down, it's quite beneficial. I'm just going to skim this for niacin. So the flushing form, 100 to 300 or 3,000 milligrams a day, according to the Linus Pauling Institute. However, Dr. Prosky and other orthomolecular psychiatrists use 1,000 milligrams 3 times a day and get up to almost 18,000 milligrams, or 18,000 milligrams is kind of the cap. So very high doses, but they work. And so the niacin flush, if you ever take a niacin, you know what it is. The body flushes. You can get lightheaded. You definitely get itchy. And, you know, a lot of people don't like it. I like it. So first thing in the morning, empty stomach, I do 100 milligrams of niacin and just ride out that flush. Not sure why I like it, but I do. There are ways to mitigate it. So if you go to our mental health pages and go to something like schizophrenia and go down to niacin, there's the protocols for mitigating the niacin flush. Taking a big dose of vitamin C with your niacin definitely reduces it down. That's the easiest no-brainer. And so some people can't do high doses of niacin, people with liver stuff, diabetes, although it's helpful in those conditions. So there's a few times you can't do it. But for the rest of us, you can. Nicotinamide, so between 300 and 3,000 milligrams a day, according to the Linus Pauling Institute. Dr. Hoffer used between 1,500 and 6,000 milligrams a day. And so Dr. Prosky, in his practice, most people need between 2,000 and 4,500 for schizophrenia, for addressing the symptoms there. Yeah, so doses between 1,500 or 6,000 milligrams being used for extended amounts of time in children and adolescents without side effects. The most common side effect for niacinamide is sedation, which is just taking one of the useful effects to a bigger extreme. High doses, like greater than 10 grams, nausea, vomiting, signs of liver toxicity. So I would never go this high. I've never had to go above 1,500 actually. So there we go. And so Dr. Prosky, not going to get elevated liver enzymes at 2,500 milligrams, and he's done tons and tons of work in the area, so he would know. Number 3, you can't get all the nutrients we need from food alone. So I kind of broke it down like this. You can't get it from nutrients. You don't get it from nutrients. And then there's the RDAs. Are they enough? This is from my presentation that I did in 2018. So don't get all the nutrients from food. It's quite clear that we don't. This is a percent of the population not getting these nutrients. So every category, at least some people aren't getting it. Percent of the US population not meeting the RDAs. So, you know, if we look at vitamin E, 86% of the population aren't getting it, but for everything else, so people aren't getting it. Here's a clue into why you're not getting it. These are healthy foods, and these are the percent of population that are getting those healthy foods. And they're not doing it. These are unhealthy foods, and these are the percent of population that are doing those things. So it's bad news there. It's not a surprise. Taste and price remain the top drivers for food selection. And so, you know, who's got taste and price down to a science in the bad sense of the word? It's the big food industries. So they're leading everything. And this is from Dr. Bruce Ames. And so this guy, if he says something, you should probably listen. And so why would you listen? Because he's published more than 450 scientific papers and he's one of the most cited scientists alive today. And so he says, for years we've been saying, eat good fruit and veggies, and that's had zero effect on the poor. You need supplements. Can we get all nutrients from food? to get the RDA of 400 IU, you need 100 eggs or 170 cubes of cheese a day. If you want to address Alzheimer's by getting the homocysteine down, you need DHA as part of one of the nutrients. The lowest amount of DHA per day that did anything at all was 100 milligrams. And so this study showed that fish once a week reduced risk by 60%, but once a week gives us for DHA about 400. So you would need 700 milligrams a week. You'd have to do fish, good oily fish, twice a week. And how many people do that? And not many who are coming to see us anyway. And this is a quote from Patrick Holford. Many people in the world will slip into Alzheimer's, which is a terrible tragedy, simply because they believe some ignorant person who told them you could get all the nutrients you need from a well-balanced diet. And another Holford quote, but this is him paraphrasing one of his closest advisors, Dr. David Smith, who was professor of pharmacology at University of Oxford Medical School. And what he said was, I'm ashamed to admit that my entire career, I taught my students that you can get all the nutrients you need from a well-balanced diet. And I never bothered to check the science. And if you do check the science, you'll find it's a problem. So we've got some great thinkers who are saying you can't do it all from food. Now, can we get the everything we need, or are the RDAs enough? So this is one of the chunks for my talk as well. And I decided to do this talk after marking the preventative healthcare assignments. A lot of you might remember this one, where you had to track your diet for 3 days. And so marking the assignments, I was starting to realize that most students were not getting even the RDAs. And so then I decided I would track it. And so when the assignments came in, I created a page or a database entry, no names attached, for each student, and went through it. And after about, I think it was about 300 students, I tabulated it all up, and shocked to find that, for magnesium, for example, 80% of the students were not getting enough magnesium. For retinol, it was like 95, and for zinc, it was like 50, and it was like shocking. And I was thinking, if they can't get it, students in nutrition school aren't reaching even the RDAs, what's everybody else doing? So I decided to do some research, and I looked at the recommendations of 5 plans there: the myplate.gov, the BC government's plan for seniors, the DASH diet. It did one of the top vegan diets, and the Mediterranean Living Diet Plan. And so basically what I did is I took 3 days of following the recommended diets, totaled the amounts of all the nutrients in all the foods, and then ran it through that database, which I'm sure if you use this, you're sick of. I spent 3 days just going through each nutrient and entering it in a database. So 3 days of compiling for every food, every nutrient, how much was in it. And then I plotted it. And so here's what I got. So here's the 5 diets I tracked: the MyPlate, the BC government, the DASH diet, vegan, and the Mediterranean. By the way, the vegan diet was woefully low until I pushed it up to 2,000 calorie diet. So without the 2,000 calories, low on everything. So here is 100% of the RDAs. So we can see that pretty much all of them met the RDAs for most of these minerals, right? The one big red herring there is manganese, and that was from the vegan diet. And where did it come from? The massive amounts of oats that were used. So yeah, take what you want from that. This was looking at the fat-soluble vitamins. None of them had enough retinol as retinol. If I had included beta-carotene components, I don't consider beta carotene to be vitamin A. It's a precursor, something that's used to it. Um, but if I included that and we did the conversions, yes, we would have gotten to the RDAs for the vitamin A. And if you look at the RAEs, that did include the beta carotene and other carotenes component, then we did meet them. Vitamin D was low for a lot of them, and vitamin E so was low for a few of them. And then if you look at the B vitamins, so pretty much across the board, except for choline, we're getting 100% of the RDAs. And so if we can get pretty much all the RDAs from food, some questions come up. Why are there sick people? Well, it's either your RDAs are too low, which is a possibility and probability, but and they're meant for healthy people. But people aren't eating enough of the food to they're not eating the right foods to get the RDAs. That's another one. And so then I started asking, is there anybody who eats a good diet, doesn't supplement, and is healthy? And yes, if we look at the blue zones, there's 5 places in the world where people routinely live to be over 100 years old. They don't take supplements. I chose to look at this one in Sardinia. They do things a little differently. And so this is what their diet looks like. And so they do grains. They also do potatoes. They do their whites and stuff, but they're not the genetically modified stuff. They do a sourdough bread, which is going to be high in probiotics. They do lots of herbs, chestnuts and walnuts, small amounts of fruit, small amounts of meat. They do mature goat and sheep cheese. So they do some cheeses, actually quite a bit of that. And contrary to popular belief, they actually don't do any fish because they're up in the mountains. And here's some other things that are interesting and important: culturally isolated, traditional lifestyle, hunt and gather and harvest, close to friends, their entire life, strong family values, laugh a lot, drink wine, one that's high in flavonoids, drink goat's milk, and walk at least 5 miles a day. Most of them are shepherders or sheep herders. And there we go. So what do we learn from the blue zones? Diet's not the only thing, because they're not really eating that much more. They're eating similar foods to some of the good diets, but higher quality food, but still it's not the only thing. Lifestyle is important. They're not exposed to a lot of toxic things, bad news, all that kind of stuff. And they live longer because the life they live is worth living. That's one of the factors. And so what's the difference between blue zones and everyone else? Something called confounders. And here's the confounders, the list of all the things that confound the ability of the nutrients that we do get to do their job. We're not going to read the whole thing, but there's a lot of stuff. It's all the bad stuff, right? And so the confounders is, I look at it this way. Here's the RDAs. Here's what a sick person needs, or person who's in poor health. And the amount that you have to supplement is the cost of doing all this stuff. And so you don't really need to supplement if you aren't already nutrient depleted, if you don't have any of those confounders. You eat according to food guidelines or better, preferably better. Exercise a lot, get appropriate sun, not too much, not too little. We can't do that in our climate. Have a traditional lifestyle. So no 9-to-5 jobs, no working in the office, all that kind of stuff. Strong family values, and remain close with friends all your life, and then laugh a lot, right? So how many people are doing most of these things? By the way, this is where our holistic part comes in, right? And I got 2 more orthomolecular tidbits. Addressing the nutrients makes everything else work better. So if you put supplements in, nutrients in, it helps with diet modification. They can eat more, they can eat better, make more stomach acid, that kind of stuff. Makes herbs work better, because herbs ultimately drive processes that need those nutrients. So I always try to preload nutrients in that I know if say they need ashwagandha, I'm going to put the nutrients in that ashwagandha influences. And homeopathics work better because they are basically signals for certain things to happen. They only happen with nutrients. Psychotherapy, just one little case report here. I had a client way back when, and she had terrible depression, was working with a psychiatrist for 2 years, no change in her depression, put her on 5-HTP, 50 milligrams. 2 weeks later, she comes back and her depression's gone. That 5-HTP makes that serotonin molecule that so absolutely required to feel good, calm, and blissful. So there we go, makes those work better. And it's quite well known that if you get the nutrients in, psychotherapy works better. And then even medications, you put nutrients in, the medications work better, especially in the context of mental health. And patience is required. So CoQ10, 4 to 8 months to see benefits in some contexts. So if you know it's going to work for a client and you give it to them and they come back a week later and go, I haven't seen any difference, you got to let them know. This is one of those things that builds over time. And coconut oil, here's another one. Coconut oil are very good for cognitive decline. And so here we go, 20 grams or 1.5 tablespoons a day, 2 weeks to see a significant improvement, and then 4 weeks for even more improvements. So that one's not as long, but if the expectation is, oh, I'm going to take it and in 10 minutes I'm going to feel better, then it's not going to be useful. So you got to pre-warn people. Even a multi. So this is Dr. Benjamin Brown, and said with multi 30 days or so, they start to feel better energetically and emotionally. And so tidbit number 5, co-learner experience working with people. That means you're both learning. That comes from Hugh Riordan. And so there's always something to learn from the person you're working with. And if you go in with that in mind, then things go better. It's better for both of you. And the last of my tidbits is this one slide that was from Benjamin Lynch, who is probably considered one of the top experts on methylation and genes, polymorphisms, and that kind of stuff. And what he said was, we need to focus on epigenetics, but so you don't need to run an epigenetic panel if you do this other stuff: environment, lifestyle, diet, pathogens, heavy metals, xenobiotics, oxidative stress, nutrient deficiencies, nutrient excesses, and consider SNPs. So isn't that what we do? That's pretty much the full realm. If you're working with a full spectrum on things you can do with a client, that's pretty much it. If you do those things, then you don't really need to dig down deep and go, oh, the genetics are driving it. And this also tells us that this is what's driving the bad genetics, right? All right, the last thing I'm going to talk about is where the confidence come from that I have when I work with people. And so confidence I have in my protocols comes from this. I know effective levels and I know safe levels. Where'd that come from? It's my exposure to orthomolecular medicine, orthomolecular presenters, researching. One of the things I do when I need to find something, it's like, what about niacinamide in arthritis? I will go to the ISOM.com or the Journal of Orthomolecular Medicine and put those terms in the search engine, and I get the results, and then I look at dosing and things like that. I do have a rationale for everything that I do with somebody, and so I know why each component would work. I research, I know, I've done a lot of research. I think I probably have 10,000 articles now compiled on several computers. Some of my favorites I'm going to show you later: Linus Pauling Institute, the NIH, PubMed, searching PubMed with PubMed plus what you're looking for kind of refines things down. And, I know that other people have done the things that I'm doing, people who are smarter than me. And so that gives me some confidence because I've seen what they've done, tried a lot of stuff I do with people on clients, I think the only thing I do with clients that I don't do myself are the women hormone stuff, right? So yeah, we got to draw the line there. And I know I can back up everything I say. I know I've drawn on it from somewhere. I know I have it's on my computer. And so that's pretty much one of the strongest things that gives me the confidence to do what I think needs to be done with people. And so that wraps up what I have to say about orthomolecular nutrition or orthomolecular medicine and how I use it and how you guys can too. So I
Thank you,
think we can go
Paul.
for questions.
Yeah, we have a bunch of questions that were sent in. Thank you to everyone who has been popping those in the Q&A box as we've been going along. I'll start with some easy ones first that you can probably do rapid fire. Teresa asked, will Paul be traveling to Brazil for the Orthomolecular Medicine Today conference?
Yes, that is my plan. So that should be fun. I'm learning basic Portuguese.
That's awesome. Good for you.
Yes.
All right, some other quick ones that we had.
Oh, wait, I
Sure.
should actually do this before. I got to talk about ISOM and then some resources. I completely forgot. So ISOM is our purpose to raise awareness and advance orthomolecular medicine. We do educational programs and events. We have a bunch of countries around the world that are part of our organizations. Things that would be resources for you guys: the Journal of Orthomolecular Medicine, the mental health pages, or COVID page, the book Light on Schizophrenia, which you can get on Amazon.com, which is actually slightly cheaper than on Amazon.ca due to some, I don't know, we never could figure it out. There's our conference coming up, and that's June 1, 2, 3. If you go, just know that 2 out of the 3 days are going to be Portuguese and Spanish only. So yes, but we will be recording it and having translation, and that will be available after the conference. I'm doing 2 continuing ed courses at IHN, nutrition and mental health. That one starts in a couple of in about 5 weeks, and clinical detox runs in September. And you can check out my website, especially my articles there, and rest of the questions now.
So an easy one here. Angelica asked, does niacin also help with high levels of anxiety?
It can. I would go with niacinamide over niacin because it has more of the analgesic properties, but niacin can do it. The problem is if somebody's already pre-loaded with anxiety and they put in something that causes the flush, then that might, they might might make it worse. But there's no contraindications for niacin with anxiety. But yeah, so niacinamide would be my choice.
And then Nancy asked, with high dose niacin, do you recommend monitoring liver enzymes?
Yeah, that's a good question. It comes up a lot. And so it depends what the high dose is. And so if you are doing, let me see, 2 grams, 5 grams, 5 to 10 grams, probably not an issue. If you go above that, then you're doing it for a long period of time. You want to periodically check. Now, here's the thing to keep in mind. If you get high liver enzymes, they may or may not be caused by the niacin. And the other thing is, if they were, they tend to go away. Well, they do go away when you stop it. The other thing is, there's lots of other things that cause liver enzymes to go up, and medications is one of them. And so sometimes the meds or the niacin gets blamed for the medications, and some of the things that cause medications that cause liver enzymes to go up are the ones they use for cardiovascular disease. So anyway, so yeah, high dose, long period of time, I would recommend periodically.
All right, there's another question here regarding the sort of statements idea that you were sharing, that high doses of vitamins do not cause death. But the question is, can high doses cause other negative affects other issues. And an example given here is that high vitamin A, they've taken Accutane and it caused damage. And isn't that basically just a high dose vitamin A?
Right. I'm glad you brought that one up. So the studies that showed that high dose vitamin A caused liver damage were done on rats and used the equivalent of 1 million IU a day for humans. The studies that use lower doses that showed that vitamin A causes liver damage included Accutane. Accutane is a synthetic molecule that is known to cause liver damage. So that's how you fudge a study to get a result you want, right? You put in something that causes damage, and then you say it's the rest of the stuff that causes it. So, if you follow Dr. Alex Vasquez or just Google him and look at his comments and articles on vitamin A, he debunks all that. Except, with existing liver damage, I would be careful.
Okay. Question here regarding the nutrient dependency that you spoke about. Do you see value in DNA tests that show genetic expressions that need support?
Yes and no. So it goes back to that last slide I showed with if you address these things, then you don't really have to worry about genetics. I wouldn't start with the genetic testing. If I have done a lot of the other work and still was not getting results, then I might go that way. And the other thing is if somebody is like, say, they come with problems and then they're addressed, but they go, I've heard about genetic testing and I want to use it for peace of mind, then I would say, okay. I would look at it though after, unless something really serious is going on, I would look at it after you've done some work with nutrition, because some of this stuff is epigenetics, right? And so are you testing for what's been influenced or what's there as the underlying?
Connie sent in another question here. One of the things I always worry about is interactions when I have a client on medications. Natural medicine database is a great resource, but it's expensive. Are there any other resources that you would recommend to easily check for interactions?
Yeah, there's a few. If you Google medications and nutrient depletions, there are a handful of sites that come up. They don't all cover the same thing, so I tend to use 4 or 5 of them and just check to see what's there. Yeah, that's pretty much it.
Question here. Do you speak to clients about specific foods that can provide key nutrients, or is everybody needing supplements in order to address those nutrient levels?
Yeah, food comes first. And so, when you hear this over and over again, you get all the nutrients you need from food as long as you eat a well-balanced diet. And then you ask whoever said that, what's a well-balanced diet look like? They don't know, or you'll get 100 different descriptions. And so if you do a well-balanced, healthy diet, a real one, like something like the Mediterranean diet, then, or even a paleo diet done properly, then that would be a good base for getting all the nutrients. And then, but let's say somebody is deficient in magnesium, it's like they have all the symptoms. So then you could go, in addition to this well-balanced diet, we want you to focus on magnesium-rich foods as well. And so we would do that, but then we'd also do the supplementation on top of that.
There's another question here. Once the body has these nutrients back, can we assume that the person is back into balance and should function properly again?
That's
And
a good
I
question.
think what it's asking is sort of that like tendency of the body to want to be in balance.
Right. So if a person got fully 100% into balance, would you need to do nutrients after that? I would say to address some context. And one of them would be stress, right? Because you could be perfectly balanced and then stressors come along, and now your body needs for, vitamin B, vitamin C, magnesium, all the B's, zinc, selenium, they all go up, right? So that would be one context. And the other one is detoxification. So you could be perfectly healthy and still be absorbing toxins all the time, like maybe vinyl chloride residues from Ohio, classic example. So now everybody in Southern Ontario needs to be thinking of, what am I going to be doing to ensure I detox that stuff? Or even regular toxins, walking outside and things. So those needs will always be over and above what we need for normal balance. I think I'll leave it at that.
Yeah, that's fair. How do you deal with compliance? Do you find that your clients are actually following your protocols for the amount of time that you suggest?
Yeah, that's a good one too. How do we deal with compliance? The way to deal with compliance is to show the reason for doing it in the first place. And so if you're very articulate and very thorough and saying, here, I'm putting this, I'm recommending this because it's been shown to do this, this, and this, and you have this, this, and this, and this is what we expect to see, then that's one thing. The other thing is, if you can put something in that will give them positive effects in a short period of time, then they'll go, oh, it's working. And the two most beneficial things for that are vitamin C and magnesium. This is why I take those up fast right away. For me, everybody goes to 6 grams a day. Now they titrate up, but they go to 6 grams a day for at least a month. And then we look at it because the results start to show up, right? I did have one client who came in, and so we did the session. I gave her all the stuff. This was like in my very early years. I hadn't learned all this stuff yet. And I gave her like 8 things. And I very clearly said, one at a time, 2 days in between, putting the next one in, build it up gradually. And so she comes in and her face is red and she's looking all sick and her energy's like down. And I go, what happened? She goes, oh, I got behind. I didn't take any of the supplements until this morning, and I took all of them at full dose. Well, no wonder you're sick. So, yeah, so explain it well, give them something that gives them hope and a reason to comply. Oh, and then don't yell at them if they don't, because a lot of times people have legitimate reasons, because there's some family issue going on, something happened, right? So you just realize they're a person.
Mhm. Nancy sent in a question about cancer patients. She's asking if you have any resources or places where we could direct these individuals if they're interested in natural or alternative treatments like IV vitamin C or others.
There's not a lot of people who actually do that, like professionals, like doctors and naturopaths, that I can think of. There's some, and yeah, I'll just leave it at that.
They are few and far between. I have one locally where I am. I know you're not very close to me, Nancy. But I'll maybe, Nancy, for you, there's a couple of people in our network who might have a good answer to that question who focus on cancer. So maybe after this, I can connect you with them as well. But I'm with you, Paul. There's not that many options, unfortunately.
Yeah, and the ones I know either lost their license because they were helping people with COVID with nutrients, or all they do now is treat vaccine-induced injuries. Yeah.
All right, we've got the last couple of questions here. Which one am I going to go to first? Where can we go to learn more? Is there a course that someone could take to be certified in orthomolecular medicine or anything like that?
Right. That the course thing is one of the things we are looking at developing. But if you want to learn more, go to our website, and the key places would be our website, Journal of Orthomolecular Medicine, is a good place. It's not going to be structured like a course, but that would be one place. And our mental health pages would be another. The let me see if I can think. Linus Pauling Institute is a great resource. Their micronutrient center. They basically pick a bunch of nutrients and they write on them in depth at a level that is far beyond what the layperson would do, but it's very good for us. And so I would do that. And there is the NIH, as much as I despise some of the stuff they do, is a good resource for nutrients and levels and things like that. So NIH plus a nutrient. And then you can root around there as well.
Okay. 3 more questions now, and I'm going to limit it to that because we're getting almost to 9 o'clock here. How do you talk about supplements with your clients, especially if you're recommending these mega doses of nutrients?
Right. So here's the thing: you do not want to get in trouble, and so you need to know what you're doing first off. So if you aren't sure about 3,000 milligrams of, say, niacinamide, you shouldn't do it. But let's say you are, and so then it's all about how you talk about it. And so you don't say this will. You never say will, because you never know. And you say this has been shown to do this. This can do this. This is how this works in the body. And you do all that kind of stuff, right? So, and you don't have to say this is going to fix you, because you should be saying this is a process that has many, many variables, right? So we have good expectations, good reason to expect this is going to be beneficial. And so we're going to try it out. The other thing is, so don't practice outside your scope of education. And that doesn't mean, oh, I went to IHN and that's where I stopped learning. So therefore, that's my scope of education. You learn after that too. So if you take continuing ed courses and other things like that, you do reading, that would be part of your scope of knowledge now. Well, I forgot another good resource. Dr. Gaby wrote a book on I think it's called Prescription for Nutritional Medicine. No, that's not him.
No.
It's Nutritional Medicine, I think, is what it's called. It's very expensive. I think it's like $500. But if you read that, you will be like pretty much orthomolecular certified. It is an incredible book. He spent 30 years collecting research for it. So actually, I think you can get an online version for like $250 or something like that.
Yeah, I think that I was just going to say, I think there is an online version now of that nutritional medicine textbook. It's a big one. I think
Yep,
it's like almost 2,000 pages or something, the latest version.
it is.
Yeah.
And but you can just go in the search box and you can get what you're looking for. We use it all the time to help guide our research for our web pages. And and Dr. Gaby, I have nothing but respect for this guy. He's like super smart, he's super funny. And he when his book came out, he was doing a talk at the conference and he put a slide up and he said, "This is a picture of a book I spent 30 years writing." And then he went to the next slide. It's like, oh, man. Anyway, I hope I helped answer that. So
Yeah.
don't declare anything to be true. That's really it.
All right, last 2 questions. This is an anonymous one personally for you, Paul. Do you still see clients one-on-one, and how could a client book with you?
Right. I spend most of my time with orthomolecular stuff, but I do see clients. I usually work with 2 or 3 at a time. So if anybody wants to work with me, you can send me an email, paul@healthybyknowing.com, and
Awesome.
we'll take it from there.
I'll vouch for Paul too. He's been one of my nutritionists during a particularly difficult point after my brain injury, which I've talked about here on the network. So he does good work. I'll put in a personal vouch there. The last question we have, what does that ISOM annual membership include? Can you tell us a bit more about that?
Right. So there are many, many resources that are for professionals, like webinars, recordings from the conferences, and things like that, educational events we've done that are recorded. So you get access to those, and discounts on anything that we sell. And so we do our own events. So like our conference would be something would be for sale, you get a discount on, and other events that we are for groups that we are aligned with, like Dr. Greenblatt, his content, you get discounts on that. And yeah, any upcoming live things, yeah.
Amazing. Well, thank you, Paul, for stuffing all of that information into a short period of time and sharing all of these resources. That was awesome. Saw lots of positive comments coming up in the chat while you were speaking tonight. And for those of you who have stuck around to the end, we will be doing the draw for those two gifts that Paul and ISOM have offered. So that will be posted with our replay. So in just a couple of days, once we have that recording available, we'll post up the winner. So make sure you watch for a tag in case you are a winner on one of those giveaways.
Yep.
All right. Thank you again, Paul. That was a really information-packed couple of hours.
Well, thanks for having me.
Of course. All right. And thank you all for being here. Have a great night, everyone. Bye-bye.
Night, everybody.